public hearing then. Did you want to say anything, Kristen? Okay. Okay. Okay, so we'll move on to public comment. Is that right? Okay. Would anyone like to address the board this morning on any subject? Okay, I'll close the public comment period session. Okay, we'll move to constituent concerns. Does anyone have any constituent concerns this morning?
I don't have any.
I've had a few, but they've already been addressed.
Okay. I want to thank our volunteers and all those that have been putting on the vaccine clinics. We've gotten a lot of positive comments about that. The commissioners have. I've gotten just phone calls, emails, and just generally, you know, a lot of times friends will call me that have been through there, and they're really appreciative of how seamless the process is, especially when you watch the news in other areas and see lines go for miles and miles and miles. And I believe that we've basically set the bar, if you will, on how to do a clinic. And I think I understand that Greg Shupian, our former director, will be going across the country to show that to some other cities on how that we've been doing our vaccine clinics so that they can be set up to do that. So we should be very thankful of our staff and our volunteers, and I would just want to recognize them this morning. I know a lot of fire departments have been helping. I think probably the rescue squad and just others in the community, and I'm sure I'm forgetting a lot of different organizations, but we appreciate everybody working together, and that's one good thing about this is everyone works together for the common purpose, and that's to get the vaccines rolled out and in people's arms, if you will. So I just want to recognize our volunteers and everyone that's working on the vaccine clinic. Would anyone else like to make a comment on that? Other commissioners?
I'd just like to echo what you said. I've had a lot of comments that are very positive. It's email or people stopping by my shop of how well and how smooth the clinics went. I made a comment in our policy group meeting the other day that when I stopped by up there and just stood back and watched what was going on, it looked like a bunch of busy bees. Everybody knew what they were doing, and we're doing a great job at it. So thank you to all the staff and all the volunteers. It's like Kevin said, we've set the bar.
Okay, we'll move on to agency reports, administrative agency reports and presentations. And the first item is our 2020 Fit Together Program Review. Haywood Regional Medical Center Chief Executive Officer Greg Caples, is it? Welcome this morning.
Thank you, Chairman Inslee and Commissioners, for allowing me to have a little time this morning to review the activities and the performance from the 2020 program Fit Together that Haywood Regional Medical Center was doing in conjunction with the county employees. Let me just take a minute to introduce myself. I'm Greg Caples, CEO at Haywood Regional Medical Center, and I've been there now for 4 months, and so there's some of you that I have met and some that I haven't met in person yet. It's a little bit of an odd time to be coming into a new place, but everybody's been very accommodating and very welcoming to me, so I just want to thank you for that. Also want to introduce Lauren Teague, who is with me today. She's a registered diabetic educator at the hospital, and she's been very involved with this Fit Together program for the last year and can help to answer any questions that you have that I may not be able to answer. And I did want to, if I could, just take a minute and tag on to the comments about the vaccine clinic, and just wanted to express my appreciation to the county and its various agencies for all the work in collaboration with us and many others to do the vaccine clinic so far. About 3 weeks ago, we did a trial run of trying to run a community vaccine clinic at the hospital, and everybody did a great job, but we quickly realized that the resources and ability by the county to do that was much better, much more efficient. And so since that time, we've really just kind of thrown our resources to that effort, and we've had probably at least a dozen people at each clinic from the hospital helping out with that, and it's just been a true testament to the collaboration and efforts in this county that I think have I think, as you've said, been a model for the state and for others as well. So related to the program that I'm here to speak about this morning, this is, I think, a really strong effort on everyone's part to try to improve the health status of those that work within the county as well as their family members. We have a nurse navigator who has been working on this program from the beginning and been very involved. Her name is Jamie, and wanted to just show you some of the data from that time period. So we had a total of 181 employees that began the program and conducted their yearly lab screening with the nurse navigator. As a part of that initial screening, she was able to identify that 32 of those individuals did not have a primary care physician, and so she was able to refer them to primary care physicians within the area that were accepting new patients. As a part of her review, she was able to determine the body mass index for the people that were participating. And among those that she was able to do that measure on, 47 were considered to be overweight and 104 were considered to be obese. So that ends up being an 88% of the total of the program participants were either considered to be overweight or obese. In the assessment process, she found out that there were some with pre-existing conditions that they already knew about and were treating. The three primary ones are diabetes, high cholesterol, and hypertension, with hypertension being the most common. Through the testing that she performed, a couple of types of tests are done that determine diabetes status. One is fasting blood glucose levels, which essentially takes a picture of where you are today with your blood glucose levels. So of those, 12 were considered to be at the diabetic range and 31 at the pre-diabetic range. And then the other test is the hemoglobin A1C, which shows a 3-month period picture of what the blood glucose levels are. And with that one, 15 were considered diabetic and 70 with pre-diabetes. She also measured the triglyceride levels, which is a precursor to heart disease and stroke. And of those that she tested, 55 were considered to be high triglyceride levels, with that being the goal of being less than 150. Also, she measured cholesterol levels. So HDL cholesterol, which is the good kind of cholesterol that you want to be at a higher level, there were 44 of the participants that had a low level of HDL cholesterol. The LDL cholesterol, which is the bad cholesterol, was measured at 3 different levels, with over 100 being considered to be high and over 130 being considered to be very high. So there were 58 that were in the high range and 57 in the very high range. This chart is a little bit misleading because all 3 areas of that, or categories, were about equal at about 1/3 of the participants. Related to hypertension, there were 111 of the participants that were measured to have a high blood pressure. And then for PSA, there were 34 that were, or 36, excuse me, that PSA tests that were done. 34 of them were normal, 2 were considered abnormal, and they were referred to their primary care physician and urologist for further follow-up. So overall, Jamie followed and navigated care for about 75 employees that had abnormal labs and issues that needed to be addressed and followed up on. As you know, of course, things became a lot different in March once the pandemic really took full hold within our community as well as all communities. And at that point, it became much harder for Jamie to maintain contact with the people that she was working with. So currently, she's following about 29 individuals that are participating in the Biggest Loser competition that she put together in order to encourage further participation in the program. So as far as wellness education, 39 individuals that were in the program took part in the $30 dietitian appointment, and 15 of those have completed a follow-up appointment, with 9 that are still continuing with that follow-up today. Jamie and others put together group education for those that were participating so that they could have opportunities to continue to learn about things related to their health status on many different topic levels. And you can see on the right side the various subject matter that she and others were able to offer to the participants in the program. And in total, she gave 28 different classes during 2020 with typically fairly low participation levels of those classes. But they range from anything from diabetes, stress management, information about fad diets and skin cancer, meal planning, blood pressure. It was all very helpful types of subject matter that she was covering. She also put together a newsletter to send out to the participants, and that went out 15 times during the year, and you can see an example of one here on the right. Exercise classes, of course, were a challenge because the fitness center was closed from March 17th through October 15th, and so a 6-month period of time when the fitness center was not open. And so Jamie offered exercise classes twice a week in outdoor settings, and as a way for the employees to have some way to be able to get together and exercise in a safe manner. And 7 employees participated in those classes. She also organized hikes on one Saturday per month, and so there were some of the employees that also enjoyed doing that and participated in that throughout the year. She came up with a step challenge that was held during May and June that was done to just encourage activity at a time when most people had shut down most activity. And gift cards were provided to those top 3 participants each month, and those were funded and promoted by Haywood Regional. And as I mentioned previously, she also put together a Biggest Loser competition, which has been one of the things that's had the most staying power. And there are currently 29 employees that are participating in that, with the average weight loss for those employees of 4.94 pounds, which is quite good. Any weight loss during 2020 is good because it's outside the norm, I can tell you that. I know that Lauren was just telling me a little while ago that unfortunately, a lot of the pediatric patients that she's seeing right now have seen some significant weight gain, even for children, and so you can imagine what the effect has been on adults. So very proud of these 29 that together have done really well and lost weight during the pandemic. And Fitness Center, 284 total memberships were begun due to the program, with 165 employees and 119 family members. And this chart, I think, probably best illustrates the trajectory of something like this and what happened in 2020. So you can see that for the month of January, the program got off to a fantastic start, with anywhere from 360 to well over 400 visits per week at the fitness center of those that were participating. And then as news of the pandemic and consciousness of that began to filter out, in February those numbers did drop some, but in March the fitness center was closed, and we don't even have the 6-month period on this chart of the closure because that was all zeros. So we picked back up again with the opening that happened in October, and I guess the resurfacing of the people that participate in the program to the fitness center has been very slow so far, and it has clearly, this illustrates, I think, just kind of what has happened during the year to anything like this, that that has become so much harder for anyone to participate in and to be a part of. Each employee that was a part of the program was offered 2 free personal training sessions when they signed up for the gym, and of those that signed up, 14 completed the free sessions. I'm sure that would have been much higher if they had had longer to be a part of that program, but it only was taken advantage of by 14, and 3 are continuing that today. So as I mentioned, the fitness center was closed for a 6-month period of time, and so that also spurred 57 cancellations due to COVID and those that have dropped out of the fitness center membership. There have been some very good wins and good catches that have affected certain individuals as the program has gone on. So one important one, Jamie was able to identify an employee with an elevated PSA. So he was able to be referred to his physician and then also urology for follow-up, and was very appreciative of that as he's been able to get care related to that. An employee was identified as having new onset diabetes, and Jamie was also able to get her scheduled to see a dietitian and to begin some diet modifications and treatments. And then another was found to have very low potassium, which is a risk for heart issues, and so she was also able to get contacted with a primary care physician and to start oral potassium to help her. So in review, I think there was a lot of pre-pandemic momentum in the program. As you could see, there were quite a few people that were very interested and engaged in the program, and were making a lot of regular visits to the fitness center and doing other things as well. And then the pandemic just caused an immediate interruption in the program, with many things having to be halted due to the rules and policies that were handed down that needed to be followed. And then as it has lingered on, it's been very difficult to maintain contact with many of the employees that have been a part of this. I'll give a lot of credit to Jamie because she's made a tremendous effort, I think, to be creative and to try to re-engage with people as well as she could. But it's just been difficult, I think, to gain that kind of reconnection to this point. And technology and other ways of trying to use that have also been put in place so that people could do things virtually if they wanted to, and to be able to try to maintain that connection at times when being together physically wasn't possible. So I give Jamie and Lauren and others that have been working with this a ton of credit for continuing as enthusiastically as they have, and we look forward to, we think that things will continue to get better. We're encouraged by, of course, the vaccine rollout and everything that's happening now, and all the confidence that should bring back to our community to be a part of things again. And so we do think that there is likely to be at least as much need for this now as there was a year ago when it was begun. And so we look forward to continuing that program with you. And I'll be glad to entertain any questions that you have.
I don't really have any questions. I just know it had to be a very difficult time to try to do this. But one of the things is, as we get back into opening up a little bit more, how can people get back in touch with you so they can restart this? Because I think that's probably one of the issues is we want to get back into it, but how do we do that?
Hey.
I reach out to them. I actually ended up getting a county email address throughout the year because it was very difficult just having a hospital email address. So now they can just type in my name on their email and get in touch with me very easily. They can contact my phone. I've actually restarted a new weight loss program for this year. I have 41 participants. That's why I was here this morning, was weighing in people downstairs. So we're seeing significant weight loss with that already, and people are re-engaging because last year was very difficult. And the biggest loser competition I did do over Thanksgiving, Christmas, and New Year's challenged them to try to stay weight, to maintain their weight, or just try to actually kind of keep it off. We're really trying to engage them with just different classes. We will get back to hiking because it got kind of cold, so I didn't want to risk anybody getting injured. And then going back once it gets warmer to going back outside and doing the exercise classes. So I send weekly email. They get newsletters, weekly things. I go to different locations, like I'm here today. I actually have to go to Canton Library this afternoon. I'm all over the place. They see my face, so they know who I am. I did miss 2 this morning that didn't come weigh in. Hint, hint. And I hold them accountable. I reach out to them. I do reach out to them when they do miss their weigh-ins or they miss their appointments, but we are getting back out and drawing more labs and just making them understand that, confidence that we are trying to maintain is that the social distancing and wearing a mask. So, yeah.
You're their conscience, aren't you?
Yes, I am. Sometimes they like to see emails from me. Sometimes they don't. A lot of them, I have their phone number, and they're like, that's not good if you have my phone number. I'm like, it's okay. That means I'm getting in touch with you. So, but we look forward to working more with them this year and hopefully expanding it and moving on past this pandemic.
Yeah.
All right, thank you.
You're welcome.
Okay.
I'm assuming is doing some increased protocol for cleaning, and I'm hearing good things about fitness locations or people are going back and working out. And can you tell us a little bit about that, what they're doing to keep it safe for us?
Yeah, absolutely. I have been a gym member for a long time in various places where I've lived, and personally, I've never been to one as clean as the Haywood Regional Fitness Center. And I don't think it's just because of the pandemic, but I know that there's a lot of extra effort that has gone in due to protocols and changes to that. So we do shut down for an hour in the middle of the day so that everything can be cleaned. We have staff that are constantly patrolling the gym and cleaning the equipment as they go, and as well as any place that would have human contact, door handles, anything you can think of. Of course, the showers and the locker room areas are kept very, very clean, are cleaned thoroughly every night, as well as during that midpoint of the day when the additional cleaning happens. We're maintaining the distancing requirements that are required of us, and so all the equipment is very clearly marked as to whether you can use it today or not. The track has one direction, and so everyone is guided to stay within all the guidelines that we have to follow. The state right now requires no greater than 30% occupancy of the building, which is actually very easy for us to maintain because it is 54,000 square feet, so there's a lot of room in there. We have moved the spin class to the basketball court. Basketball is one of the activities that we are not back into at this point. It's just too close a contact, and so we're instead using the court for other things, and particularly the spin class, because it's much easier to spread the bikes out than it is in where they were located before. The pool is used only for laps currently, but it's being used very regularly. And so we're seeing the attendance go up every week. And last week, I know we exceeded the 400 per day for the first time. And I think we will continue to see that go up in stair steps as time goes on and people continue to get more comfortable with it. We do want to spread the word with everyone that it's very safe to be there. I use it, and I think that everyone that is there feels very, very safe in doing so, and hopefully they'll continue to come back.
Yeah, I'd like to commend that staff out there. I mean, they're in control. You get in trouble if you don't have your mask on too. I actually got in trouble for not having my mask on.
Yeah.
And I think the participants out there do a good job of cleaning up after they work out on a machine.
They do. I think there's a lot more public consciousness of that than maybe before, and so I think that the members themselves are doing quite a bit to keep the place safe as well. I mean, the hardest thing about it is that the mask is required at all times, even during strenuous exercise, right. And so that can be difficult. but we do enforce it, as you said.
Yeah.
And I think the members enforce it too with each other. So I think it's just a very safe place to be.
Yeah, I have been impressed with that. And also, I wanted to thank you as well and the hospital in regards to the vaccines and working with the county and providing the vaccines that you had and knowing that maybe you couldn't dispose of it properly or the way it could be disposed. And that's a big step to have those two groups work together to get the vaccine out to the community. And I appreciate that.
Thank you. We've got a lot of people that have taken it to heart, the effort, and are very, very passionate about making sure that we don't waste anything and that we work very collaboratively with the county. And I think it's been a great exercise for us.
Yeah, thank you.
Okay.
Thank you.
Anybody else have anything? Thank you.
All right, thank you.
Okay, our next report will be from the Broadband Strategic Plan Update. We have our Broadband Committee Chair, Deborah Porto, and Program Administrator David Francis here this morning. Welcome, y'all.
Morning, Commissioners.
Morning.
Can't believe it's already February 1st as well, too. The next two things we're going to be talking about broadband, and then we're going to be talking about affordable housing. You know, these are things that are critical in Haywood County and all across the country. And as you'll see, the partnerships that we have made here trying to address these issues are central to what successes that we have and how we've moved forward. Russ Harris, Sarah Thompson from Southwest Commission has been a great partner, and we couldn't do a lot of what we're doing without them. I don't think they get enough credit with what all they do, and I'm very appreciative of them. So we had started a broadband committee a couple years ago. Dr. Deborah Porto came and gave a report to the board back in September. Since that time, we had a great grant special supplemental round that came out. And GREAT stands for Growing Rural Economies with Access to Technology grant, funds that will deployment of broadband. The grant was announced on September 14th, 2020. Application deadline was October 14th, 2020. And there was a 10-day protest period in there that opened up on October 17th. Resubmissions after the protest were due on 11/11/20, and awards were announced in December of 2020. The supplemental round, first time Haywood County eligible for this state grant due to that we're a Tier 3. You know, last year and years before, us being a Tier 3 knocked us out of a lot of grants for broadband. Most of those grants went for Tier 1 and Tier 2. So this was the first time we were eligible for this, and it was due to certain census tracts that would be eligible that did not have certain speeds. The Tier 3 areas served by less than 25 megabits per second download and 3 megabits per second upload. A byte is about 8 bits, megabytes are about a million or so. And one business told me, says, I don't make any money on download, I make money on upload. So that's one of the things that we have to do. So this was only 3 megabytes going up. So great grant applicants were private broadband service providers, partnerships with financial contribution allowed from nonprofits, including the county. So the Great Grant Committee, the Haywood County Broadband Committee, became aware of the opportunity in August of 2020. To prepare for the opportunity, the Broadband Committee created an information sheet to encourage internet service providers to apply for eligible areas in Haywood County. The North Carolina Department of Information Technology Office announced the grant opportunity on September 14th. On 2 days afterwards, the Broadband Committee, Dr. Porto, sent out emails to folks, Charter Spectrum, AT&T, Carolina Mountain Cablevision, Haywood Electric Membership Cooperative, Skyrunner Telemetrics, and Education Resource Consortium of Western North Carolina. And this is the information sheet that was mailed to them. And this sheet was there to help them score points because this grant was, you total up the points and how many points do you get the grant or get into the play. So Mayor, Haywood County is eligible economically distressed county designated as a Tier 3, and most tracts meet the definition of the rural census tracts. Haywood County may provide financial contribution to offset some of the required match of the great grant applicants. Haywood County with Southwestern Commission Council of Governments will assist with the grant writing, assembling county data and details as requested. Southwestern Commission has experience applying for great grants and charges a nominal fee. Southwest is offering low-interest loans there. Showed what the partnership, you get 6 points, unserved households, 3 points, unserved households to be served 2, unserved businesses more, 3 points, and other criteria there that, Deborah took the time there to help, spell this out in the most simplest of terms to help generate interest here for Haywood County. So the Great Grant, something special around, Skyrunner responded by email for follow-up. No other organizations responded for any discussions. Only Skyrunner. All the other internet providers I read off to you, none of them responded back to us except Skyrunner. We had 2 Zoom meetings with Skyrunner to discuss the broadband needs of Haywood County. Skyrunner contacts the Southwest Commission to write the application. The Broadband Committee reaches out for support letters and from citizens, businesses, education, government to support the Great Grant application. October 7th, Haywood County issues a request for proposal to internet service providers applying for the Great Grant. The county agrees to partner up to 49% of the required match. Skyrunner is the only internet service provider to submit a proposal back to the county. None of the other folks, none of the other companies, none of the information or service providers say anything back, only Skyrunner. So the Skyrunner Great Grant application summary is fiber to the homes in Crabtree, Jonathan Creek, Fines Creek, and the Bethel areas. Some of those dots that you can see on there. The Great Grant map is the dark and light red colors of that map. Okay, let me see if I can. The dark red did not have any 10 to 1. The lighter red had 25 to 3. And the no color there looks like the topo map. That's the band there that had service. Okay, so Skyrunner application, again, was 1,447 households and 12 businesses. Great Grant, there was map errors there. The FCC Form 477 data is used for most federal and state grants. The FCC broadband data is not correct for all areas. This is one of these little things that just drives me bonkers, because we deal with this all the time. If one location, one house, 1 point is served, the FCC considers the entire census block is listed as served. How dang ridiculous is that? Internet service provider submission to the FCC is voluntary, and the data may not be submitted partial or understated. Carolina Mountain Cablevision data submitted to the FCC may not be correct. Many areas listed as 8.1 under the minimum threshold of 25.3 megabytes required for the Great Grant. Haywood County Broadband Committee asked Carolina Cable Mountain Vision to update their data to the FCC. We still don't know if they've updated their data or not. The state office still doesn't have current data from the Carolina Mountain Cablevision folks. So the purple is Carolina Mountain Cablevision homes challenged and protested this grant by Skyrunner. They challenged 1,155 homes. The remaining Skyrunner application was only 292 out of that. I understand Carolina Mountain Cablevision protesting. If they're serving all 1,155 homes and the businesses that are in that location, that's fine. If they're being serviced by them. But if they're not being serviced by them, and they're not coming to the table and sitting down with us and helping to partner with this, then therein lies a big problem. We've asked for a meeting. We asked for a meeting last week. It was declined. Dr. Porto and I are going to ask for another meeting to meet with our broadband committee next week, because this is the problem. If you say that you're servicing an area, then service it. And if you need help, there was the grant right there. The Carolina Mountain Cablevision could have participated in the grant with us just as well if they had some underserved folks in their territory. So we still don't know exactly what all their territory is. I know there was a comment in the paper that, been there for 10 years. But if we don't know and the state office don't know, how are we going to get through this problem and process together? So the Carolina Mountain Cablevision challenged, again, the 1,155 homes. As you can see, what took out there, all those were taken out. And then the challenge areas, we went and looked at that there. In the area that's there, that was in part of the challenge area, does not have the basic minimum. Doesn't have the 25 to 3. They're listed as 8 to 1 on the FCC map, but we still don't know if they are serviced in that area. So this cost Haywood County a great opportunity. Russ did a tremendous job of putting the application together. And when this thing came together and it was going down to Raleigh, I felt like we were this close. And that we were getting, our citizens, a heck of a lot closer. And this is what I don't understand, we gave everybody the opportunity. Everybody had a chance to come to the table and work with us to help get this grant. And so in the end, the protest was upheld by the North Carolina Department of Information Technology because it was an overlapping territory, apparently. So Haywood County was prepared to act quickly in working with the internet service providers to respond to the special grant, the great grant opportunity. The county was willing to contribute up to $1 million in the partnership offer. Skyrunner created an excellent application based on the Great Grant Mapping Tool to partner with the county to expand broadband service to our citizens. Carolina Mountain Cablevision and other ISPs did not respond to a request to apply for the Great Grant. I cannot mention that enough at this point. Carolina Mountain Cablevision challenged and indicated Carolina had service in some of those areas. Skyrunner applied for. Do not know if these addresses actually have service again. Now we must continue on and figure out where we go from here in the next round. We've heard from the state that there might be some release of some funds in the future, still putting some things together, but we don't know yet what that grant will look like. Since we are now a Tier 2, maybe that'll help us there, with some more funds. But, we're working hard to make, to make things happen and to make a difference. But if we can't get the folks to the table, we can't do this. The legislators have tied, the municipalities, the counties' hands where we can't own, we can't sell, we can't do anything like this. The big boy groups have got that thing so, wrapped up in Raleigh, we can't do nothing. And we've pleaded and pled, still nothing. And this is where we are. I mean, we've all, right here, all beat our heads against the wall. When we're fighting and trying, and then you can't get people to do the simple thing. And so that's what's really frustrating about this. And I admire Dr. Porto for, if I didn't have her, none of this would have gotten us where we've gotten. She has been instrumental in this. We started talking 3 years ago, and and here we are. But we've come further and have gotten great organization out of this. As you see that, when the grant come out, 2 days later, boom, we were on top of it. Had a way for the internet service providers to come to Haywood County and help them apply for that grant. So, wanted to bring you up to speed. Dr. Porto can, you know, if you've got any questions for her, I'd be glad to. Russ Harris is there. Be glad to, you know, any questions there. Remember, Dr. Porto is a doctor, so she can answer all the harder questions. I can just do the real simple ones. Okay. Yep.
I know, it's funny, I had a lady call me about the time we were turned down for this grant that lives out in the Hemp Hill community, and she basically said that Carolina Mountain Cable wanted $30,000 to bring internet to her subdivision. And then I hear, you know, that they're getting in the way. It's unfortunate that, you know, then I hear that they're getting in the way of us being able to provide service to citizens. It's almost like, yeah, we can provide that service, but we won't unless you pay, you know, a lot of dollars, if you will. So, and it's just ironic that that happened when it did. And I know I remember when I first was a commissioner, the cable TV companies would come once a year. Do they still do that, David, or what was that?
There was a franchise fee.
Franchise fee?
That was part of that, and then I can't remember the year, Mr. Chairman, that went away, but that franchise fee went away, because, you know, at that point in time, it was, what was Charter's previous alliterations, you know, that they were there, yeah. And we had hired a consultant to help, you know, get that franchise fee up a little bit more. But then some of the communications acts that were passed after that, with the Wireless Communications Act and other wires, that franchise fee went away. I can't remember the exact dollar amount they were paying, but I'll look and see when that went away, though.
Well, it's been several years ago, but I guess in technology world, that's probably centuries ago. So, but, you know, that was a way that they kind of came hat in hand, if you will, and we always, you know, moved on, helped them out. But did you want to say something, Dr. Porto?
No, one thing I'd just like to emphasize, I appreciate all the positive comments that he uses my name, but it's actually the committee. David put together a fantastic committee that includes Kim Jackson from the public schools, so we have all the public school input, George Rowland from the community college, so we have all the resources of the community college. Of course, Joey is always in the background here somewhere, you know, is incredible. Keith Conover from the State Broadband Office, they have been incredibly useful as well. Michael Sorrells, one of your previous commissioners, just has lots and lots of information. David, working with all of you. So I might be the manager of all this, but there's a lot of resources out there that are really pulling this together. And I guess I also just want to thank the community. We had 22 support letters written for this grant, and these were just a portion that have been written for other grants as well. And particularly the school system went to bat. And I was reviewing a few of these before the meeting, and the Bethel schools really went all out. The principals, students, parents, you know, on sort of saying what their problems and issues were. So we're going to keep, you know, working really hard at this. It's a very complicated, technical area, but just the Mountaineer writing a nice article was very accurate. Your contributions and focus on this, pulling all these internet service providers together are really how we're going to get forward. And, you know, Russ and his group at Southwestern Commission is pulling us forward to make sure we're aware of what all those opportunities are. So I just wanted to add, it's a big group effort. It's not just a couple people.
Okay, that's good.
We have a good leader, that's for sure. Let me just clarify, there was the grant total amount of money was only $30 million. There were 71 proposals, 54 counties, with grant requests of $107 million, and only 18 projects were awarded out of that round. So I'm going to do like my good Baptist preacher Hugh Garner told me. I'm going to end on a good note here. Russ and I got an email from the governor's office back in the late fall about hometown grant for some Wi-Fi in our community centers. Back at the end of December, 1st of January, we were awarded 2 of that, so we put some Wi-Fi into the Beaver Dam Community Center and out at the Pigeon Center as well, too. So we did have a small win here at the end of the year. We also have another grant that we were awarded from the Appalachian Regional Commission that we're working on, that we'll be sending out an RFP sometime this month. Sometime this month, and it'll help some of the homes in the Fines Creek area there, but it won't be as dynamic or as big as this one was here. Any other questions, Commissioners?
So you notified Cable Mountain, and then they didn't respond to the grant at all, and then they objected to the application based on Skyrunner's joining in with the grant.
That, but crossing into their territory was the objection.
But I understand that. So,
yeah.
But they didn't respond to the initial request. Now, that service area, how are they granted that service area? Or how are they claiming that service area?
That was started back when, Russ, do you know how that, I don't know how they got, that was.
Well, these are all private businesses that
Right.
run their own business and decide where it makes sense for them, where it's profitable. I understand that it's a business that's sort of evolved over time, and so it's not that they have a service area, it's just where they have chosen to put their service, and then where they have chosen to report it to the FCC. There's no rule that says there can't be 5 different providers in the same location. That's totally a competitive issue. In fact, it's better for the consumer if you have several choices.
Sure.
It drives the prices down. One point I'd like to make is we make a big deal about these grants are trying to get us service of 25 megabit, download 3 up. That is very small. That is the minimum required by the FCC. And if you were in an urban area, other parts of the state, you'd have 100 megabits, you might have a gigabit. I mean, we were talking about scraping for the absolute minimum, so it's not like any big deal. But that's why competition is a really good idea, that there might be multiple providers in different areas. But we want to support, all the providers in any way they want to expand. We want to share county resources when it's available. We want to give them the information. We meet with all these providers on a regular basis when they'll meet with us. And we ask them, what do you need to expand? What would help you? And then we try to give them those things as much as possible. So the more the companies meet with us, the more information they have, the more we have interaction back and forth. So we're just trying to build those relationships with everyone so we don't have this kind of, thing happen again in the future.
But I guess the problem is, if you don't have cooperation, how can you build a relationship? It just seems to me that Carolina Mountain is coming in and claiming that they provide service to an area that possibly they don't really can provide service to, and therefore their numbers to the FCC are inaccurate, and that inaccurate claim allows their objection. And I mean, if they're truly providing false information, then that...
They're not providing false information.
Well, if they're not providing the service, then what are they doing? That's what I don't
Every
understand.
company, in there, to come to their defense a little bit, every company reports by these small census blocks, and with David's help and the county GIS coordinator, all kinds of people helped us understand all this little intricate detail. They say that they are voluntarily send data to the FCC, and they say, we have someone in this census block, and then that whole area is covered in and served. And it's because it's the only data we really have. All these grants are based on that. Even though they know it's not right, it's better than nothing. So most likely, what they and Charter, AT&T, everybody has that problem, is they put that in and their area is served. And many of the people who call the county, and the committee tries to go out and talk with them, first show them where they are on the FCC map. I encourage all of you to put your address in. I put it in the presentation. See what service it says you have, and then look to see what you do. Then I tell them what other providers we're aware of are around their area that they might call, because every time you call, you get in their database that there's been a request for service, in that particular area. So we don't know what areas they have for the FCC because of the way their numbers have been reported, but just because they reported they had a census block, it doesn't say that they have served everyone. Just like the other providers as well. And many of us have personal experience. We're in these blocks that are served and we don't have service.
So if they serve, so basically they're getting around making any false representations because they're serving one person in a certain area and then that's all the FCC
They are totally
requires.
following the law, and they are doing what every other provider does, is they're putting in their data that we have, one or more people in this block that are served, and that little block is colored in that says they're served. So they're not doing anything wrong, and no other provider is doing anything wrong. It's just that there's a lot of pressure on the FCC to change those maps. Now, to sort of, I won't say combat that, but to what the committee is trying to do is to have as much data as possible. So we take in all the FCC data. We take in any other data that the state provides. There is a state survey that the Mountaineer put in, and I encourage everyone to take it. They're collecting their own data. And when we have a state grant, they will use all of that data. They won't just rely on the FCC. And one of our committee members, Keith Conover, told me recently, in a future great grant, we could take the opposite approach and ask a provider to, apply for a grant, and then basically put our protest data in. This area says they're served by FCC, but here's our data that says these people reported they're not served, or we did our own local survey, or this is the school system data. And I thought, now that's a really great idea. We can use the protest data for our benefit. Instead of knocking money out, we can try to knock money in.
So what is your opinion on why they didn't join with the grant? If they provide service to those areas, and those areas would have been helped by this grant, why did they not join in it? And then, thus, did they provide any information as to why they did not do that?
Many of you are small business owners, or run farms on the side, or you work with small businesses. I think every business has their own strategy and their own plan, and we have met with them in person. I just can't answer that question. A lot of times it's knowing the right person to talk to have the right relationships, and we have done everything possible to build that relationship, and we'll continue to do that. But the other companies didn't, respond either. But the idea that, a company that's locally based, has local-based decision-making, we would hope would apply and would engage with us. So I really can't answer your question.
Okay. The other thing is that I know that probably in the future there's going to be another way to provide internet services, and that's probably going to be through satellite communications and instead of the hard infrastructure that most of them have to put in now. Do you think that's why you're not getting participation on these grants? I mean, let's face it, some of this technology is going to get old, just like all of it does. I mean, remember the guy who applied not too long ago for the satellite, the ground to the, I mean, and that's the future, probably.
Well, I'm trained as an electrical engineer, so I feel like I'm a good, reader of information. I'm not an IT specialist. So we follow pretty much the guidance of the state broadband office, and their view is that wired or fixed wireless connections into your home are the most future-proof. I mean, we're already behind, so we want to get up with the current technology, the most future-proof possible. Just like rural electrification, it probably will take years, but ultimately everybody wants to have a gigabit connection to their home. And those connections are either hard or expensive or have long latency with other, types of things. Now, if you live 1,000 miles from anybody on the top of a mountain, that satellite is probably going to be your best connection. And probably for a lot of people, there's going to be this transition. Well, I can't get a fixed now. I can get a fixed wireless, or maybe I can. You have to live within sight for the satellite. So it's possible, but I will say what I understand to be the state broadband committee, the state broadband office view, and what our committee is using is that we are promoting the financing, the availability of a wire, fiber, or minimum a fixed wireless to your home. So it's not to say that satellite is not a good option for some people, but the ultimate goal is to have something to your home.
Oh, you know more about it than I do. I'm just asking questions.
We're trying to take all this information in, and I'm sure I'll get some comments about this, later on. Anything is better than nothing, but boy, does your heart cry when I reread this support letter, from a mom who's, bringing their child to a parking lot someplace to download on a slow internet, to do their homework. And, I guess the hospital people aren't here anymore, but, how many people are trying to do telehealth? I mean, you just cry. Some of the small business, there's a farmer that wrote about they wanted to sell their organic crops, but, they need to advertise on the internet and they can't do it. I mean, we're just crying at the committee meetings all the time. How do we do this? We've got to find a way to do this.
Yeah.
And then we go cry to David and he makes us feel better.
It's just unfortunate that we're here where we're at because of them not responding. I understand, David, did you say that you've reached back out to them and maybe next week you're going to get together?
Yeah, we tried to set up a meeting last week with them, and that didn't come to fruition. We're going to reach back out with them this week for them to sit down with the broadband committee, which meets next week. So we'll ask them to come to the table then.
If there's, oh, go ahead.
I was just going to say, it'd be nice if we could get them to the table and get them to understand, we're trying to work together. We're not trying to work against you. Mm-hmm. We're trying to work together to bring money here so that we can fix the problem that we have. Running this last election, seems like that's one of the most important topics that comes up every single time, is broadband. We've got to get it in our areas because we can help the farmer, we can help the mother that's trying to help with her kids' homework, especially with our circumstances of 2020. And I don't know what we need to do. If we need to reach out to our legislators, or if we need to fix something on that end, or again, if we could help them understand what we're trying to accomplish, if we could just get them to the table, seems like mean a lot. So,
I was just going to make a comment that if there's one thing that's consistent is that the cable companies don't communicate too well, because I hear that all the time, even in town. I mean, I remember I had a tenant one time that was wanting to get cable, and he ended up getting satellite because the cable company never would respond in town, And it's funny, but, where my office is located, I was just thinking I've got fiber, AT&T fiber, I've got Skyrunner, and I've got cable TV. And they're always bugging me on switching. And it's like, instead of bugging me, why don't you go out and try to extend it to where you can really help people, instead of, it's great to have competition where I'm at, but our community is just underserved. And the other point I wanted to make was, I think we were second in the whole state in this grant until Cable Mountain.
Well, we were scoring it and thought that we had that high of a score. Yeah.
We thought we were maybe second on of the other grants, and that's how strong a position we were in until Carolina Mountain Cable, cut our legs out from under us. So.
It's a sad day. We all shed some tears after that, and Russ tried to go help Skyrunner, submit another application, but it just wasn't as robust as the previous one was, and of course, didn't meet, with as few households as it had in that second submission. It just wasn't accepted. So we're keeping our fingers crossed. Like I said, we've heard that there may be some more funding coming down, so we'll keep our fingers crossed, and maybe we can get these folks to the table where we can talk to them, and let's see, let's make these partnerships, let's develop these partnerships and make them work, because we're doing it, and I get some companies, it's called the take rate, that we talked to another potential provider, and that we can run the line here, here or there, but they're worried about, just Commissioner Rogers take it, Commissioner Kirkpatrick doesn't, Commissioner Best thinking about it, and they worry about who's going to take that, who's going to take the service, but if they spend the money, they're worried about that. So there's lots there, but when there's money there to help you offset those costs, and develop your network and
Right.
develop your business. It only seems to make good business sense to me, you know. And I kind of get that, we weren't going, I didn't think we'd hear from AT&T. I was hoping we might hear from Charter, because, we run up, a lot of times that people can see the Charter just right out the window there. And and they say, well, how much is it going to cost? And, like your example, Mr. Chairman, was it's $30,000 to get it there. We hear that a ton. The companies are not just willing to make that, that investment. And I understand it's a significant investment. I understand that. But there's, there is still a return on that investment. It's going to take a while, and it's becoming, we hear, electrical and stuff like that. But it's just as important of a utility now as well too.
And I just wanted to give a shout out to Skyrunner. I personally have theirs at my home, and I've never seen a company that is so eager to reach out and work with you. If you contact them, they'll come out, and their employees are so, I guess, happy, or they just think it's a great company to work with. And Skyrunner was going to put in $2 million to match this $2 million grant, I think, right, David? So.
Yeah.
So if anybody out there would like to try to get internet and you're in the rural area, Skyrunner is a good option, because I'm in a rural area, and all I had was DSL, and which was very, it was okay, but when it went out, you were usually on the telephone for an hour trying to find somebody from AT&T, and they basically would say, oh, we got to come out. So it was really frustrating, and the service was kind of sporadic at times, but Skyrunner's been very consistent. And it's very high speed. My daughter and my son-in-law are living with us right now because they're working on their house. But he works from home, and they have as fast enough speed that he can do meetings from home and things like that. So it's very, I don't understand internet speeds and all that, but evidently it's a good signal and everything. So, but if people in the community are trying to find, they might want to check with them, because it's wireless, and if you can see a tower, they can maybe service
And if
you.
people want to contact me through the county manager's office, 828-452-6625, or my email address, which I kind of think it's funny because, trying to email me when you don't have internet, but is david.francis@haywoodcountync.gov. And what we've been doing as well is we get a complaint or an issue, and so we've been turning them over to the broadband committee, and we're cataloging those, and we're keeping up with those. And Deborah reaches out, to that homeowner. We try to figure out, is there a way to bridge those gaps there and fix that. She's been out to several HOAs, working with them, trying to get service there. So we've got a few successes on the way there as well too. So it's going to be a work in progress. I ain't going to, I hope all of us can see, some end of it, but it's just, it's just a problem, and it just, and we're trying to get it from all sides that we can. But as you said, Commissioner Rogers, we need help at the legislative level. It starts there. It starts there. Yes, ma'am. Yes, ma'am.
I'd like to say I feel the defeat when you both you and Dr. Porter talk about this, and don't feel defeated. We appreciate the efforts. I do, and I've had several people reach out to me. I have clients from all over the county that have struggled with getting internet, and it's become so important recently, obviously in the last year. So work. I have a Skyrunner myself, and have continued what Kevin said, is that they always want to help. And I was unable to get their product or their service at first, and they apparently have a system. They reached out to me and said, hey, we've got this coming on board, and we'd like to provide service for you, because I also could not get service and had bought this home in 2014 and did not think to ask that. Yeah. And then having had Charter, which is super fast, it was crazy to think I couldn't have it at all. Yeah. So I appreciate that. It's, I think about what we're doing with the vaccines, and that system just goes to show we all work better when we work together. So for the Cablevision folks not to come on board and not want to work with us is unfortunate, but something good will come of it, I'm sure.
Yeah, I'm hoping. Fingers are crossed, that's for sure.
Our county needs it, yeah.
Yes, ma'am, that's very, very true.
Do you think that their reasoning is just, it's just so cost prohibitive no matter whether they get the grant or not?
And I can't speak to their finances, but
we all know how costly it is to put that in. I mean, there's no question about it.
There was a grant there, county's willing to participate in there. And, there was a chance to sit down and say, hey, I can't do, because the top end of that grant was, the $4 million. I can't do that, but I can do this.
Yeah, I think that's the frustrating part that I have, is that they won't explain. If they just say, this is the real deal, and this is how costly it is, and you go get that grant, and that's great, but now everyone's expecting us to provide this service to all these people, and we can't do that. It costs us 10 times what you're getting. Is that, and maybe that's the case, but I wish I just knew that.
Yeah, and then, and so that grant's there to offset those costs. It benefited the company. They're going to have some skin in the game, but in the end, it was going to benefit the company as well. They didn't have to come up. If they had $500,000, there's another $500,000 in capital there for you, and more. It just, it made dollars, and they're not making sense to me right now. So I don't get it.
Hey,
do you have any information on apparently there's some other rural counties that are running internet service with the power companies?
Yep. We have been working with other with our EMC as well, and and that's their hesitation. That take rate, what I was talking about, is their hesitation. The Haywood EMC territory, some of the other EMCs have, and I can't remember the exact. There's so many people per pole that they have, and our folks is less than that average there of folks that are on per pole that pole services. Okay, so we have fewer clients on, or the Haywood EMC has fewer clients on the pole than other EMCs do in the state, and so that's what they worry about. That here's the cost, and here's that cost, and we run it out there to here, yonder, and there, and then what's that take rate? Do you take it? He doesn't, and then we've still got that cost in there, and so that's prohibitive to them about thinking and expanding. But we met with Haywood EMC 4 times in the last 2 years, and they are getting a little bit more warmer and a little bit understanding, and I think they're working and trying to figure it out as well too. Okay, but EMCs they can't, they have to create another LLC or what's the word there? Another company. They can still there, but to do that they can't it just can't be the one EMC. They have to run another company there.
A subsidiary.
Thank you. I was biting my tongue to get that. Thank you so much. Yeah.
Tommy had a comment. You there, Tommy?
Yes, I'd just like to thank David and Dr. Porto for working on this. And also, David made a comment, it's going to have to come from the legislative level. One of our number one goals at the Legislative Goals Conference 2 weeks ago was broadband to underserved and unserved counties. And this is a problem that's been revealed during this pandemic. I heard some of the same horror stories that Dr. Porto alluded to earlier. Some of these very rural counties in eastern North Carolina, they're even in worse shape than we are, if you can believe that. Like Hyde County, Ocracoke Island, with everything going on with trying to do remote learning, it is a huge problem. And I certainly hope it's caught the attention of our legislators. And it is a number one goal, priority for us at that level. So hopefully we can continue to push on that end, and everybody else, can do their part maybe we can have a breakthrough at some point in time. So again, I just want to thank David and Dr. Porto for all their work on this.
Thanks, Tommy. Yeah, that's,
Thank you, Tommy.
yeah, that's, I can believe that. It's really like the legislature needs to change their approach on,
Yeah.
I mean, I think there's areas, you got to look at this like they did when we were running electricity and water lines and sewer lines. You didn't have private companies doing that. I mean, well, I guess you do, but they're regulated, but it's, it's almost like they want it to be a free-for-all, and it is a free-for-all in the towns when it's easy to get to, like here in Waynesville, but it's not a, it's
And
not
the
easy to
density
get
there,
to.
density pays the money,
Yeah.
So,
Yeah. So, okay. Does anybody have any other comments? Thank you, Dr. Porto, for all your work, and Russ, wherever you, appreciate everybody's work on this. Okay, our next item is the Southwestern North NC Home Consortium update. David, I think you've got Sarah Thompson here and Russ too.
Sarah, Russ, Don McGowan.
And
We're all here.
Don McGowan.
Just to touch on the high points, they'll talk more about it. Back in the summer, we talked about the HUD Home Consortium program, and we were, at that time, we got approval from Haywood County, the other 7 counties, and the other municipalities to start this consortium. Forming a consortium is a way for local governments that would not otherwise qualify for funding to join other contiguous local governments to directly participate in the home investment partnership with the HUD program. So forming this partnership, Southwest Commission's been herding cats, for the whole time, trying to get the counties and towns all in here. And so, it's some good news that we'll share with you that the consortium was approved. Don and Russ are going to talk to you about some of the ins and outs of that. Haywood County is part of this consortium. This consortium, deals with affordable housing and other programs in there that we'll be dealing with. The Haywood County will be the lead agency for this program, but the program will be administered by the Southwest Commission. The funds will be passed through here, but and we will, have, we're a county that we're 30% of the population of the other 7 western counties, and the other counties agreed to us to be the lead agency as well to this. So I'm really happy to announce this. Dr. Porto, a citizen that had a belief in getting this done. Don's another citizen that had a belief in affordable housing and getting that done, and those two deserve a lot of credit in helping us get and pushing us forward where we're getting to nowadays. Thank you, Don.
Thank you, David. Good morning, Commissioners. You all know me. I'm Don McGowan. Live in Waynesville. I'm chairman of the Smoky Mountain Housing Partnership, which is the affordable housing division of Mountain Projects. Today is a great day for Haywood County and indeed a great day for southwestern North Carolina. We have received a formal approval from HUD to form our consortium, and HUD has also notified us that we will be receiving home funding in the next fiscal year, which would mean probably we will get funding in the third quarter of 2020, this year. This was a real team effort to get this across the finish line. There are a lot of people I need to thank. I want to start by thanking Bryant Moorhead. It was in March of 2019, Bryant, that I first visited you in your office. And to your great credit, you didn't kick me out. I had this crazy notion that I found a loophole in the Home Investment Partnership regulation that would allow us to get home funding here in this region. And you listened to me and you encouraged me, and here we are 2 years later, ready to get this over the finish line. So thank you, Brian. I'd like to thank David Francis. David has been totally supportive of this effort, and indeed he's helped us out with other affordable housing initiatives here in Haywood County, and he does so much to make the county a better place to live and work, and I thank him. A very, very special thanks goes out to the Southwestern Commission. Without them, we couldn't have done this. Sarah Thompson, the executive director, Russ Harris, Director of Community and Economic Development. And lastly, I'd like to thank all of you, the Haywood County Commissioners, because you have agreed to not only be a member of the consortium, but also to be its lead entity, which is critically important to its operation. Now, I know we have a new commissioner on board, and you didn't hear our original presentation about a year ago. And I don't want to take you through the whole thing again, but I just want to highlight what this consortium is all about and what it means to not only the county, but the region. At a very basic level, the consortium will consist of 6 counties and 13 towns here in southwestern North Carolina. This has been a moving target, but that's where we are right now. The lead entity will be Haywood County, and under a separate agreement with the Southwestern Commission, the Commission will be the administrative agent, and as such, they'll be responsible for all of the operational aspects of managing the consortium. So that burden is taken off of the county. As to funding, we've been notified by HUD that our consortium will receive approximately $538,000 in initial funding starting in the third quarter of this year. Going forward, we will automatically receive each year additional home funds from HUD based upon the budget that HUD receives from the government and the composition of the membership in our consortium. The current allocation, while being very significant, was impacted by the fact that Cherokee County decided, for whatever reason, not to be a member of the consortium, at least for this present year. And when they opted out, we lost the towns of Murphy and Andrews due to the contiguity requirement of the regulation. So hopefully if we get Cherokee back into the fold next year, our funding probably would go up by another $140,000. There are 2 match requirements in the program. The first is a one-time match equal to what we're going to receive for funding, which is $538,000, and a funding threshold of $750,000. If you do the quick math, that's a difference of $212,000. So we will need to come up with a match of $212,000 one time. The Southwestern Commission, through the good efforts of Russ and Sarah, are working diligently to find a way of sourcing that for us. The good news in that is that the one-time match comes back to us in the terms of grants. So the first year out, we will have $750,000 of monies available to grant out for programs here in the southwestern region. The second match is a 25% ongoing match requirement on all funds that are drawn down on the program. And that money will be paid by the nonprofit housing providers on a project-by-project basis. As an example, if the Smoky Mountain Housing Partnership had an affordable housing project, we were awarded a $100,000 grant for that project, we would have to come up with an additional $25,000 as a match for it. The beauty of this program, besides the annual funding, which is significant, is that it's very flexible. Home funds can be used to finance the rehabilitation of owner-occupied housing and rental properties, down payment assistance to home buyers, usually in the form of a soft second mortgage program, acquisition and construction of owner-occupied housing, tenant-based rental assistance, and acquisition and construction of rental housing. Now, on the funding side, home funds can be dispersed as outright grants. They can be various types of loans, loan guarantees, interest rate subsidies, and they can even be equity investments in a project. The targeted demographic for these funds are households that are at the 80% or less of AMI. Now I'll turn it over to Russ, who's going to talk about some of the administrative details on the program, and then we'll open up for questions.
Good morning. My name is Russ Harris. I am the Director of Community and Economic Development for the Southwestern Commission. If I knew David Francis was going to say kind things about me, I'd come more often, I think. But I'm joined this morning by Sarah Thompson, our Executive Director, and Caroline Lafreniere, who is a Senior Project Manager with us, and she will be in charge of this housing program. Before I start talking about housing, a lot of our work in community and economic development is focused on issues that kind of go beyond county boundaries. There are some things that are county issues, and then there are some things that go beyond county boundaries, and two of those are broadband and housing. And no matter what community we go into, we hear that issue. So I'm going to back up just a second to talk about broadband, and I think it becomes apparent that here in rural areas, a lot of it is us trying to figure out ways to solve our own issues. And as mentioned before, one of the main issues is knowing where there's service and where there's not service. So I think Dr. Porto mentioned the survey through the state that's in the Mountaineer this week, and we also have that on our Facebook page. We have a pretty extensive effort to try to push out that survey. It's being funded by Dogwood Health Trust. We've got videos from different sectors talking about the importance to those sectors of broadband. And if you look, I sent David an email on Friday with a dashboard showing where responses have been across the state. The darker your county, the more responses you've had. And there's a big dark swath over the western part of the state right now. We understand that a big part of our issue is getting accurate mapping so that we can go after those grant funds in the future. So I say that to say anybody who's on Facebook, please share that post with your constituents and in your community so that we can get more responses and have a better picture of where we need to go. So on the Southwestern NC Home Consortium, I think Mr. McGowan explained that very elegantly and covered a lot of the details. As he mentioned, we're eligible for about $540,000 a year. This will be renewable for the next 3 years. The heavy lift is here in the first year in terms of the work that's required and the matching funds. But then we think about the impact over the next 10 years. We're looking at over $5 million coming to this region to alleviate this issue. Right now, currently, we're in the process. One of the things we have to do to get those funds is we have to have a consolidated plan in place, which kind of takes a deep dive into the housing situation in the 6 counties that are participating in this. And right now, we're working on that. The next step is to do stakeholder meetings with all the member governments. So there's one February 22nd. There's one for Haywood County. We have I think, Brian, you're on the invitation list for that. And he can pass that along to anybody who's interested in being a part of that conversation. And that way we can get a better idea from local communities, what is the issue, what is the best way to address this issue. Administering a program like this is consistent with what we've done at the Southwestern Commission for 50 years, where we get access to federal or state funds, and then we subcontract those out to local partners who can help address that issue. Our Workforce Development Department contracts or subcontracts out to Haywood County Schools to do workforce programs. So this is kind of what we've been doing and what we do normally. Trying to think of what else Don didn't cover. He covered it so well. As he mentioned, the idea behind this is that we want to find local partners. In Haywood County, it may be mountain projects. They will be eligible for the match. And I think it's important, too, as local government stakeholders who signed on with this agreement, no project can come out of your county without county approval. So you're not going to be surprised by a project or anything else. If a nonprofit wants to do a project in your community, that final approval comes from your representative, whoever that may be, of whether or not you put that project forward. And I think that's the broad strokes of kind of the program. Again, Haywood County is the lead, and we would be the administrator. And I'll take any questions, or at least hand questions off to somebody else.
How are the monies distributed? Is it based basically on who makes application, or is it based on geographical area? I mean, if one county makes applications for all the monies through a particular entity, then that county gets the money?
Yes.
Or that entity gets the money for the benefit of that residential community in that county?
We, as part of this consolidated planning process and bringing stakeholders in, we'll have to kind of nail down the details of how that process gets decided. We don't want to turn into a food fight between, we have 19 local governments have signed on. So even though we had one county didn't sign on, and we've lost a couple of towns due to that. I mean, 19 member governments in the West signing on is a very positive thing. It could also become a very contentious thing when we start deciding where the money goes. So we'll have to kind of nail down that process. But it will come down to, who's addressing the need in what communities and who's making that application.
And who makes that final decision?
That'll be a stakeholder group that will have representatives from the members in that.
Will that stakeholder group have a name?
Yes, but I don't know what we're still getting there with that detail.
Okay,
But it would be the steering committee for that, for the consortium.
thank you.
Yeah, absolutely. Anything else?
Anybody have any other questions?
So the first, once we start in July, it'll be 3 years, that it'll be an automatic renewal, and then we'll have to go through a little more extensive process at 3 years, but nothing like what we're going through right now.
Okay.
All right.
Well, I would
Thanks.
say if Cherokee doesn't want to be in it, you know, we don't want to encourage them too much because that's just less money for everybody else.
Well, and we would like, at this point, yes, we would like them to join eventually because they bring about $130,000 back into it if they come, but
Yeah.
they can join over the next 3 years, but they won't add to the allocation. So for them to add to the allocation, it would be 3 years down the road.
Oh, okay. Okay.
Yep. All right. Thank you.
Okay, thank you.
Well, at the next meeting, I'll be bringing forth the agreement from Haywood County as the lead entity to the Southwest Commission to administer this program. So we're rolling along, and so we'll be doing that at the next meeting. Yeah. Any other questions? All right, thank you.
Thank you.
Thanks, Dave. Appreciate all Southwest Commission and all of your work too. Okay, Bryant, we have the introduction of new county employees.
Thank you, Mr. Chairman. Today we have several employees that joined us through January 18th. At the Sheriff's Office, we have Christina Esme, Michaela Meyer, Kyle Estudio, Danny Hoglin, Sherry Green, and Carrie Toe. At the library, we have Ashlyn Moody. Health and Human Services, Patricia Brooks, Paige Potter. At the Tax Assessor's Office, Jessica Robertson. And Development Services, we have Timothy Philo. Thank you, Mr. Chairman.
Okay, great. Appreciate those people coming on board. Hey, does anybody have any discussion or adjustment to agenda this morning? Okay, I'll move on to our consent agenda, and we just have 2 items this morning. Does anybody have any questions about the consent agenda?
I guess I did on that second item.
Okay.
It says Governor's Crime Commission, in order to provide trained officers with less than lethal weapons, handguns, long rifles, and gas mask pouches.
Okay,
And
Sheriff,
maybe I should understand what that means, but I don't know if they're being trained on something less than lethal weapons or trained on how to use lethal weapons less.
Good morning, Commissioners. To answer your question, this is a Governor's Crime Commission grant that we received in the amount of $20,667, and basically what that's going to fund is it's miscellaneous equipment and so forth, and filling gaps in unfunded other areas. In response to the less lethal weapons, that's exactly what it is. They are less lethal options in the escalation of force that has to be used or can be used in the commission of our job. Less lethal ammunition, less lethal weapons. In this particular incident, we're talking about beanbag rounds, we're talking about soft projectiles and so forth that would be used to settle a situation in lieu of using lethal force. And yes, that's the equipment, and that is the training as well too that would be used for that. Yes, sir. In the hopes of not having to use lethal force.
Sure.
Yes, sir.
Okay, does anybody have any other questions on the consent agenda? And you're okay with this, Sheriff? Yeah, okay, Sheriff's good. Okay, hearing none, I'll entertain a motion. We can approve the consent agenda as presented.
So moved.
Second.
Second.
Any other discussion on that? Those in favor indicate by saying aye.
Aye.
Okay. Anyone opposed? There you are, Tommy. Okay, we'll move on to our regular agenda. Our first item is to request approval for a resolution declaring firearms surplus and authorizing the trade of surplus firearms for other firearms. And we have our Chief Deputy here again this morning. Welcome, Jeff.
Good morning once again, Commissioners. What this is the request to adopt the resolution to surplus our existing handguns that are right now at the 10-year mark for replacement as well too. So the resolution that we're requesting you authorize and accept is stated. It says, whereas North Carolina General Statute 160A-265 authorizes the Haywood County Board of Commissioners to dispose of surplus property, and under North Carolina General Statute 143-129.7 allows bidders to purchase as trade-in property owned by the county, and under North Carolina General Statute 20-187.2b allows officers the options to purchase their duty handgun weapons at a predetermined price upon securing a permit as required under North Carolina General Statute 14-402A. And whereas Haywood County has in its possession 85 used weapons, which include 72 Glock 22 Model 40 caliber handguns, 10 Glock 23 40 caliber handguns, 1 Glock G27 40 caliber handgun, and 2 Smith & Wesson MP 40 caliber Shield handguns, which have previously been used in service by employees in the Haywood County Sheriff's Office and are no longer of use by the county. Whereas Craig's Firearms Supply Incorporated, police distributor, is the only state-designated approved vendor who can supply Glock handguns, and the solicitation of bids will not be utilized. Now, therefore, be it resolved, the Haywood County Board of Commissioners in general session on Monday, February 1st, 2021, hereby authorizes 72 Glock 22s, 10 Glock 23s, 1 Glock G27, and 2 Smith & Wesson M&P 40 caliber shields be declared surplus in order to be traded for new Glock firearms on state contract with Craig's Firearms Supply Incorporated, police distributor, and the deputies have the option to purchase the same firearms from the state contract vendor at a predetermined price upon securing permit as required under North Carolina General Statute 14-402A on this first day of February 2021. Just requesting the approval of that for us to go ahead and surplus those weapons and let them be replaced.
Okay. Does anybody have any questions?
Chief, if the employee decides not to purchase their firearms, what happens to them at that point?
As far as the firearms go that we'll surplus.
Right. If the employee decides, I know they have the option to purchase that.
Yes,
that
they would go back to the state contracted vendor, which is Craig's Firearms, for trade-in value as well too.
So we'll get trade-in value.
Either way, you'll either get trade-in value back by the weapon and/or by the sale to the deputies. Yes, sir.
What are we replacing them with? Still a Glock?
We are staying with Glock, yes.
Okay.
Yes. And Craig's Firearms is currently and will be until June of this year, is the state contract bidder for Glock firearms.
Okay. Any other questions for Jeff? I guess these are they're just wore out.
Yes, sir.
Was that from practice? Because I know y'all don't use them. I mean, hopefully you don't have to use them. Training, yeah.
Yeah, thankfully so, but we have to go through mandated qualification every year, and that exceeds their use after a certain number of years. But yes, thankfully we haven't. So.
Yeah. When I first read this, I was like, well, we shouldn't have to replace those. They don't have shootouts or anything, but your training is very important. So
yes.
So you're ready when you do have to do that. Hopefully never, though. Okay, so I'll entertain a motion. We approve item 1 of the regular agenda.
So moved.
Is there a second?
Second.
Okay. Any other discussion? All those in favor say aye. Aye. Okay, it's unanimous. Thank you, Tommy.
Thank you.
Okay.
We should have Tommy on the big screen.
Yeah.
We could see him.
Do what? Okay. Our next item, number 2, is to request approval of a contract between Haywood County Health and Human Services Agency and Meridian Behavioral Health Services for community linkages to care for the remainder of fiscal year 2021 in the amount of $38,680 for fiscal year 2021-22 in the amount of $77,360,000. Both amounts would be paid from fiscal year 2020, 2021, and fiscal year 2021-2022 budgeted funds and approval for the county manager to sign all documents pertaining to said contract. We have our Health and Human Services Agency Director, Ira Dove, here this morning. And it's hard to say that 2021, 2022 as fast as you can. So how are you doing, Ira?
Good morning, Mr. Chairman, Commissioners. I also have here with me Megan Hauser, who is our supervisor over this program. I am here to request permission to get a contract with Meridian Behavioral Health to do the Community Linkages to Care grant that we have with the state of North Carolina. They would be responsible for assisting us in meeting the different requirements of the grant. We had previously worked on this Community Linkages to Care grant and have chosen to go a little different route in that previously we were talking about a syringe exchange, and that will not be part of the grant going forward, that we'll be focusing our efforts on providing different kinds of services, or Meridian will. They'll work closely with the Sheriff's Office, the Health Department, with the hospital, EMS, and other community partners to provide individual plans for the persons, and also to link them to the care and services.
Okay, does anybody have any questions? Okay.
How are you going to monitor, how are you going to monitor the success of the new program, where you're going to use it?
The success of the program, we have to provide statistics to the state. And so I believe we'll be monitoring the success of the program, looking at how many people they work with, whether they actually are getting, a lot of the people they'll have to work with would be community partners like the Sheriff's Office, whether or not they actually are showing up and getting the referrals from the Sheriff's Office, whether or not they get the referrals from the hospital, how many services they provide them and what kinds of services they provide, whether or not they do the training. Some of the trainings are supposed to be with community partners that they're offering, whether or not they actually show up and do those community training partners, whether they reach out and work with us. We're trying to work with them on getting things like naloxone, whether they do that and get those distributions. So those are the kind of things that, Megan Hauser will be monitoring for us.
Yeah, I think that's been a concern for, at least for myself and for people in the community, is monitoring the program and making sure that we're getting help to the right people, the right type of help. Yeah, so this program now will not purchase any syringes or drugs as far as Suboxone, correct?
We have never purchased syringes, and we have never purchased the naloxone. What happened was we partnered with someone who one of their focuses was to run the syringe service. So we paid the salaries of persons who were running the syringe service program with the grant funding. So now that will not happen because Meridian has a different focus. Their folks don't run a syringe service program.
Yeah, thank you. I just want to be real clear about that. I know there was some confusion and concern about that before.
Yeah.
Yeah, I believe the state said we were in the top 3 in the state, the way this program was administered the last time we were talking about this. So I appreciate everybody's hard work on this. I know that it affects a lot of lives for the positive.
Yes, we're open to
and the state gave us a glowing report, so even though some folks didn't believe it, I guess. But anyway, I won't go there. Does anybody have any other questions? Okay, so I'll entertain a motion. We approve the second item of the regular agenda.
So moved.
Second?
Second.
All those, any other discussion, by the way? All those in favor indicate by saying aye.
Aye.
Thank you, Tommy. All right, thank you, Ira and Meg. Thanks for being here this morning.
Thank you, Mr. Chairman and Commissioners.
Okay, the third item is to request approval to accept a quote from Messer Heating and Air in the amount of $24,985 to be paid from fiscal year 2021, fiscal year 2020, 2021 budgeted funds for replacement of HVAC at the Health and Human Services Agency Meals on Wheels. Operations Director Chris Boyd, welcome.
Good morning, Chairman, Commissioners. As stated by the Chairman, I'd like to request approval to contract with Messer Heating and Air to replace the HVAC at the Meals on Wheels location. Something important to know is when we remodeled this facility in 2010-2011, we did not replace this HVAC unit. This particular unit was not part of the docking replacement, and it was left over from the old Walmart days. It's well beyond its life expectancy, so I'd like to replace that. Also, something to be noted, you will see 3 estimates in your package. There is one estimate that is lower, that was by Bolton, was for equipment quoted as York equipment. The York equipment is smaller in size, has less BTUs, and also only has a 1-year warranty. The Carrier equipment as quoted by Messer Heating and Air is larger, sized more adequately for the space, and it also carries a 5-year warranty on the equipment.
Okay. Any questions for Chris on that? We have another one right after this one, so. Okay, I'll entertain a motion. We approve the third item of the regular agenda.
So moved.
Second.
Second.
All those in favor indicate by saying aye.
Aye.
Okay. Number 4 is to request approval to accept a quote from Messer Heating and Air in the amount of $89,775 to be paid from fiscal year 2020, 2021 budgeted funds for replacement of HVAC rooftop units 2 and 4 at the Law Enforcement Center. Go ahead, Chris.
Thank you, Mr. Chairman. You will see in your package there are 3 estimates, or actually 2 estimates and 1 no bid for this project. The 1 no bid was offered by a group that was not able to secure the proper equipment for this facility. This equipment was specially designed when the facility was built because of the relative humidity requirement inside the pods. These 2 particular units will serve 2 of the 4 pods. The requirement for the humidity has various stages of introduction of air. So the AON units were specifically designed for the pod areas to control this, to meet the state specifications for our inmates. You will see that the lowest bid there is Messer Heating and Air.
Okay, any questions on this one? How old are the units that you were replacing? Are they 15 years old?
We built the facility in 2004, occupied, maybe December of 04, January of 05.
Yeah.
So these units have been there since.
16 years old, yeah, okay.
You may get a little more use out of them in a normal environment. Please understand the environment for the Law Enforcement Center. The doors never close there. It's a 24/7, constant introduction of non-conditioned air at all sides of this facility. So these systems never get to rest. If you take, for instance, this particular building here, most people are out of here by 6 p.m.
Yeah.
So there's no introduction of non-conditioned air for a period of 10 or 12 hours, typically. That facility does not. 24/7, doesn't miss a day. Yeah. So they're just not going to last as long as they would in any other facility.
Chris, are we seeing problems with these units, or is it just a recommendation to change them ever so often?
We have constant issues with
these
units. That's what I thought. Not just these. We have issues with all of the units. We've been on a program to replace those. We did 2 last year, 2 current year. I'll be requesting 2 next year to slowly replace those. But we spend a significant sum in not only maintenance but repairs annually. I think that if the sheriff and, well, they're not here, but if the sheriff and chief deputy are here, they'd attest to the problems. And there's 4 units that serve the 4 pods, and those are the units that we have to be very careful with, because we have temperature requirements, we have humidity requirements, and various other things for those inmates based on the state code. So we have to make sure that we get those repaired and keep those in tip-top shape at all times.
Any other questions for Chris? Okay, I'll entertain a motion. We approve item 4 of the regular agenda.
So move.
Second.
Second. Good.
Discussion. All those in favor indicate by saying aye.
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 Thanks, Chris. Okay, the 5th item is to request approval to set the advertising date of March 24th, 2021 for the 2020 delinquent real estate taxes. And Greg, or tax collectors here, Greg West. Welcome, Greg.
Thank you, Mr. Chairman. Good morning, Commissioners. A couple of things this morning. First of all, General Statute 105-369A requires that the tax collector report the total unpaid taxes for the year 20 through 21. The levy was $40,464,068.81. To date, we have collected $37,384,901.92, with a remaining balance of $3,044,287.82%. We have a collection percentage is 92.48%. Secondly, I would like to request the approval to set the advertising date of March 24th for the 20 delinquent real estate taxes, and be glad to answer any questions.
When's the last day that you can pay before your name's in the paper? That's what they always ask.
That'll be March 19th.
March 19th.
March the 19th.
If you don't want your name in the paper, pay by March 19th.
We'll be mailing out delinquent notices sometime around February the 12th, and then the advertising to follow.
I would remind people that the mail is not as dependable as it used to be. I think they're starting to get that straightened out. I believe there was a big glut at the over Christmas holidays, and hopefully that's starting to get smoothed out some. But
yeah, it's coming around. They're doing better.
Yeah. Okay.
It's not quite 6 weeks behind like it was.
Okay. Now, if they want to drop off payments here, is there something outside?
Yes, we still have our drop box out front, just to the right of the front steps. You can drop those in out there at any time. The assessor is also using it to drop off their listing forms and stuff. So, just like to encourage communication. At this time. We have $3 million still out there, and there's a, pandemic going on. But if you could please communicate with the office, then that way we have a better chance to work something out.
Yeah, I think that, you make people, as long as you communicate and let them let you know kind of where you're at and everything. In the past, I'll get comments or I'll get complaints about, the tax office did this and the other. Then I find out that they just didn't do what they told the tax office they were going to do. So if you do make, arrangements with the tax office, make sure you carry through on it, because, this is all by statute that we have to do these things by. So
yes, sir.
By state statute, that is. Does anybody have any questions for Greg?
No, just we're open as well.
Yes.
I mean, we kind of made it sound like all you could do is drop it in a drop box, but you can come inside and make your payment.
You can certainly come inside. We just require the mask, and please take your temperature at the front door there.
You can also pay online. I know there's a service fee for doing that, so it may be a better option to either drop off or come in. But I also want to make a note, if you do drop off in the box, don't leave no cash.
Correct.
We don't want you to leave cash out there. So I think it's convenient for several ways for people to pay. So just want the public to be aware of that.
We've had a lot of people use Dropbox, well over $700,000 in payment and dropped off out there, so it's been very beneficial.
That's good.
I know the county manager, Joe, said we might ought to get 2 of them.
You got it.
Double the money.
You know, the staff has worked real well this year. I mean, we've been, you know, meeting people outside the front door since March, and I'd just like to show appreciation to the taxpayers out there as well for their patience and continue to, you know, do the right thing.
Okay, I'll entertain a motion. We approve item 5 of the regular agenda.
So moved.
Is there a second?
Second.
Any other discussion at all on it? All those in favor indicate by saying aye.
Aye. Thank you.
All right, thank you. Thank you, Greg. Okay, our next order of business is appointments, and our only item of the appointments is to request approval and appointment of Lyndon Smathers to the Clyde Planning Board ETJ alternate.
Thank you, Mr. Chairman. The town aldermen of Clyde recommend the applicant of Mr. Smathers to the ETJ alternate seat for their planning board. He's been a resident of the county for 20 years. He's retired, but he hopes to have greater input for the betterment of Clyde and let people know what a great town it is. Thank you, Mr. Chairman.
Okay, we have a motion to approve the appointment.
So moved.
Is there a second?
Second.
Okay, all in favor indicate by saying aye.
Aye.
Aye. No voice from above, Tommy?
Aye.
There he is. Okay, that concludes the agenda. We do not have a closed session. Is there any other business to bring before the board? Hearing none, I'll entertain a motion. We adjourn.
So moved.
Is there a second?
Second.
Okay, we're adjourned. I guess I'll say aye. So.